Welcome to Navicent Knows Health. I'm Cindy Busby, and I'm here today with Dr. Edward Young. He's a board-certified internal medicine physician and also an associate professor at Mercer University School of Medicine. And today we're going to talk about his hospitalist practice here in Central Georgia. Dr. Young, thanks so much for being with me.
Sure.
Would you let the audience know first about your internal medicine journey as a physician? Where did you start and where are you today in terms of your practice?
I started right here. I started at this hospital. I trained I did medical school here, and I trained here. And then I went into private practice and had an office practice for 4 years. I still have patients come find me in the hospital and say, hey, you remember? But so then I left the private practice to start one of the very first hospitalist practice in Georgia, much less in the nation. We did that in 1998 and have been practicing hospital medicine here since.
When it comes to being a hospitalist, how would you define the hospital's role as you see it as a physician? Before the patient's view, how do you see your role in terms of the physician's role?
It has been I think a life-changing role for the patients, because not all of the time can their doctors come to hospital to take care of them. Many of them come from far away. We provide the care of a primary care doctor for them, a surrogate you might say, while they're in the hospital. Our job is to oversee and manage their medical problems while they might be here for a orthopedic procedure, any other type of surgical procedure. We're the doctors who can manage their diabetes. We often find and correct problems with medications that might have been conflicting before they came in the hospital, and we recommend changes for when they go home and those type of things. We advocate for them with specialists sometimes about procedures where we find other things wrong that need to be done. We recommend after they leave hospital, we communicate with and recommend to their primary care doctors and their outside doctors what should be done in the aftercare once they leave the hospital, and things that need to be, closely followed on.
Are all hospitalists, let's just say at Medical Center Navicent Health or Baldwin, are all hospitalists internal medicine physicians, or they have other specialties?
Not all. About 94% of them, 95% of them are internal medicine doctors. There's some family medicine doctors who are practicing as hospitalists.
Do they have to have any special training to be a hospitalist outside of their specialty once they come to the hospital?
The answer is training as an internal medicine doctor is a specialty. And we train very hard, and believe it or not, most of the training in internal medicine is focused on hospital medicine. So it's kind of a natural fit for internists to be a hospitalist. But there is no dedicated hospitalist track as a specialty as yet. There are some places that are developing it at University of Michigan, University of California, San Francisco. But most of the time it's transition out of your residency into a hospital medicine practice.
You mentioned sometimes hospitalists are managing patients who come in for procedures and some who are admitted for medical conditions. So you do both. If I came in for a surgery but my doctor is in Dublin, you might manage my care when I'm in the hospital on his behalf.
Actually, yeah, the term we use for that is co-management, because we work closely with the surgical team, and they do have office practices, and so they're not all the time in the hospital. The nice thing about a hospitalist is we're always here. We always have a team of people here, and the nurses can reach us, and we can come to the bedside and provide care. And so that would be a co-managed environment. We do primarily take care of people if they come in with a disease such as pneumonia or something like that that's not a surgical diagnosis, but we're the medical doctors. Then in that case, we're the attending physician, and we might call a specialist to work with us in that environment, but we'd be the attending physician for that.
If I come to the emergency room and I have pneumonia, are you able to admit me to the hospital with or without a relationship with my primary care doctor, or do you contact them normally if I have a PCP and I'm admitted to the hospital? How does that path start?
It's really it's been an evolution. Back in the early days of doing this, all the PCPs were very involved and had hospital privileges. Most of the PCPs in our area no longer have hospital privileges. Matter of fact, they're so busy in their offices, they rarely communicate and say, we're not sure everything that's going on at the hospital, but we communicate with them. The things that drive where patients go often sometimes can be insurances, okay? That can drive what hospital they go to and things like that. But everybody needs to understand that if you're acutely ill, your insurance will let you go to the nearest hospital you want to go. You know, that all those insurance relationships only refer to pre-planned procedures. You know?
So taking an example of pneumonia, I come in with pneumonia. At what point do I meet the hospitalist who will be the partner to my care, or the manager in a way of the care that I receive, the medical care in the hospital?
The first person you meet is the emergency room doctor.
Right. That's right.
And then the emergency room team will then contact us to transition you into the hospital. We are a team of over 30 doctors, and so it's often a complex process for who's going to take care of you where in the hospital. It has to do with the 600 plus beds in this hospital and where people are, but we as a team have a very coordinated care process where most of the time you're going to have the same doctor for most of your hospital stay once you're here. Might not be the person who brought you out of the emergency room because that's an admitting team, but we have a care team on the floor that then provides your care for most of your stay. Hopefully it's a short one.
And that was going to be my question. Once that patient is introduced to the physician, the hospitalist who will care for them, you generally try to keep that physician with them, of course, if they're going on or off their schedule, but as close as you can get.
There's so many variables involved. If the patient has to go to an intensive care unit, so things change, but we try very hard to keep people aligned because we try to have doctors on certain floors for periods of time. I just spent 5 days in my work cycle on one floor taking care of the same group of patients. Not the same, I sent a lot of them home.
What are some of the ways that hospitalists make sure that patients and their families know who they are, and if patients are taking notes about their care, what are some ways that you guys are making sure that you're communicating with families?
Oh boy, that's changing radically. Obviously when we enter the room, you're introducing yourself. COVID has dramatically restricted the patient's family's access to hospital. We've only recently opened up the process of having family members in the room, and you can only have one right now. Depending on what happens in the current surge, we're not sure where that's going to go. But most of the time, I spend a lot of time on the telephone, because I'm calling the family members and telling them, here's what's going on. Now, if the patient is able to do that themselves, then they can do it. But often I'm having to call as the representative and tell them, here's what's going on, here's what the plan is, and reassure them and tell them, where we are in the hospital stay.
Have hospitalists had a role in managing the COVID unit patients also?
Absolutely.
Okay, and they were, I know some of them, of course, you have patients who are in the ICU, but did you dedicate certain hospitalists to that because of its specialty?
They dedicated themselves. It's kind of interesting. And my team of doctors, when all this came out, thanks to my gray hair, they looked at me and said, you stay out there on the floors, we'll take care of the COVID patients. And I said, well, gee, thank you very much. But anyway. So we've had some doctors who have had COVID, and it said since they're by definition immune, that they now do most of the care of the patients in the COVID units. So, but this hospital has several, dedicated units for COVID patients, and there's often an intensive care unit doctor that's in charge of that care, and we share care or co-manage in those units.
When it comes to the way medicine is evolving and through COVID adding so many virtual platforms, are there opportunities, and maybe not here where hospitals are in the hospital, but where hospitalists manage care virtually for smaller hospitals?
We have anticipated that. We would love to be involved with that. This hospital has some subsidiary hospitals that are smaller that we can certainly provide that care and extend our hospitalist reach out to some of our outlying hospitals. Yes, we could, and we've got a wonderful telemedicine suite at this hospital that could do that.
When you think about the personality of a hospitalist who could come from different specialties in medicine, what do you think is the personality of a hospitalist who will like what he or she does and the patients will love the way they're cared for? What's that recipe for that personality type?
I think the old-timey saying is, we know you have an ability, but we want you to have an affability, okay? And you need to develop the personality to have interactions with people in a stressful situation. That is often not the first things people who are going into a scientific study of medicine learn. Often they haven't had another job or anything where they'd be involved with interpersonal contacts, but most of the time they develop the ability to have affability, and we have coaching programs for that to help them do that as well.
Do you find today that your hospitalists who are joining your large group are coming in at the beginning of the career, or the middle, or the end of their career?
All at the beginning. All at the beginning.
Okay.
All at the beginning. This hospital has got a special credentialing process for creating the subspecialty of hospitalist here. And if you desire as a doctor to leave your private practice and become a hospitalist in today's world, here you cannot. You have to have a very high number of hospital contacts on patients to qualify as a hospitalist here. So most of the people who come into our group are coming straight out of their training and meet the definitions and credentialing of being a hospitalist.
If you wanted to tell the viewers watching one thing that they should remember about hospitalists and that specialty, what would you tell them?
Hospitalists are hospitalists because they like it, and they want to do that, and they want to help. And they see that this is a need for care in the hospital because it's a complex environment. And having somebody who's overseeing, I don't want to use the word in charge, but we were looked at as the person who's actually in charge of the care medically while they're in the hospital. I'm certainly not going to say we're in charge of surgery, no, but we're in charge of the medical care out on the floor. And once you know that's your responsibility, we take it very seriously. And we want to make sure people have a safe stay in hospital and that we can get them out better than they came in.
Well, thanks so much for telling us so much about your specialty.
Sure.
And thank you so much for joining us at Navicent Knows Health. If you'd like to know more about Dr. Young and his practice, please visit us at navicenthealth.org.